Hello, everyone. Good evening. Nice to see you here again tonight, everybody. So, we are here on our Facebook Live on Delegation and Prioritization every Thursday at 7 to 8 p.m. Sponsored or brought to you by Matus Nursing Review. So, before anything else, my name is Mr. Alan Matus, and I am a nurse educator. I've been teaching students for almost 25 years. I'm also a nursing faculty. I'm also the author of a book that I published in Amazon. The title of the book is Simple, Fast, and Easy NCLEX Review. Okay, so thank you very much, everybody, for being here again tonight. And I'm so happy because tonight we have prepared great questions for you. And can someone tell me what is the focus topic for tonight, everybody? Okay, can someone tell me what's the focus topic for tonight? Okay, so that would be, I just said that in the comment section. Everybody was guessing cardiovascular, COPD, pediatrics, but actually it is COVID. So COVID, not exactly everything about COVID, but using COVID as part of the scenario. Okay, now what is the reason why you want to attend this session every Thursday? It's because we're discussing a very important topic in the NCLEX, which is your prioritization and delegation. And attending these sessions will help you pass your NCLEX examination because definitely these concepts will always be in the NCLEX. And we have a lot of students who have been telling us that prioritization delegation is always there. Why? Because it's part of your test plan. You know, it's already there in the test plan. More likely, you're really going to get these kinds of questions in the NCLEX. Okay, and also this is Matus Nursing Review, wherein we offer simple, fast, and easy NCLEX review, and just for very affordable review fee, $143 or something. We're going to discuss that later on. You'll be able to master your core content in nursing. Okay, so before anything else, welcome everybody. So thank you very much, Cleofi. Yes, you're right. You got the COVID. Yes, that's the topic for tonight. Yes. And then also welcome everybody. I think I have flashed all of your names in the at the beginning of the session. So let's go straight to the point. The first agenda that we have for tonight is going to be the motivational photo of the week, and I think everybody likes this segment because you want to be inspired and you want to really study consistently. So this is a photo that was sent to us by our student Sharon. So Sharon sent this photo after work actually, and obviously she's enjoying studying probably because there's an ice cream beside the computer screen. Okay, so that's a very nice photo, everyone. Okay, so that's a very nice photo. So keep motivated and always study. All right, another one. So we have, as usual, we have a testimonial from one of our students. This was actually from Annie. So Annie just recently passed the licensure examination. So she graduated 2006 in the Philippines and took the NCLEX PN exam last August 22 and found out last August 24 that she passed the NCLEX. I bought the hoodie jacket with a free 3 months online review and free Facebook Live every Thursday. I recommend Matus Nursing online for preparation of your NCLEX. It helped me a lot, especially in prioritization and delegation. Thank you, Sir Alan, for sharing your knowledge with us through Matus Nursing Review. So thank you very much for that recommendation, Annie. Okay, and of course, I think we have mentioned earlier that we have been thinking the last time what to call ourselves in this session, and I think that at this time, for now, let's call each other, everybody as part of the Matus tribe. Okay, so because we belong to a community wherein our goal is to pass the NCLEX examination no matter what. Okay, and I'm here to support you guys. I offer services that are affordable, and at the same time, this has to be services that can really help you in passing your NCLEX examination. Okay, so again for tonight, the same thing. Everybody that joins our session or who joins our session will have the opportunity to win the free 90-day online access NCLEX review. So we already have a lot of winners every week. and they are all reviewing online. So please, if you pass your NCLEX, let us know. Can you please send me an email so that I will know that you'll actually pass your NCLEX by using our program, everyone. So thank you very much. And again, at the end of the program, we're going to announce the winner of our free 90-day online access NCLEX review. Okay? All right. So everybody again, so let's go and start our first question for tonight. And that's what I have said. Okay? The focus for tonight is going to be a little bit about COVID. So let's see. All right. So let's have the first question, everybody. Can you type on the comment section a big yes, okay, that you are ready to answer our first question for tonight. Okay. So let's proceed. Number one question. Okay. So this is a prioritization question. Okay. Involving a not really COVID for tonight. So this question, you really have to find out if this will be the answer for tonight. Okay, so analyze your question very well, and I really would like you to give the rationale for the answer. So number one, the nurse receives the following clients in the emergency room. Which of the following clients requires priority intervention? A, the 25-year-old client who complains of generalized severe pain in the abdomen. B, the 55-year-old client who sustained a left hip dislocation due to a fall while hiking. C, the 46-year-old client who reports fatigue and runny nose due to possible COVID-19 infection. Or D, the 28-year-old client who is asking for pain medicine due to severe migraine headache. Okay, so choose which one will be the best answer. Okay, so the nurse receives the following clients in the emergency room. Which of the following clients require priority intervention? And always remember, again, you have to use your principles: your airway, breathing, and circulation, your neuro check, of course, your level of consciousness, risk for infection, pain or comfort level, and of course, another one will be especially about airway. Okay, but then in this situation, can you really apply those principles over here? So what principle are you going to use? So which patient is the most unstable? Okay, and what is the priority? The answer here in this question will actually be a big learning experience for you, because usually some NCLEX questions revolve around this, especially how to handle patients when they arrive in the emergency room. And can you please put on the comment section why you chose a particular answer, everybody? Okay, choose in the comment section why you chose a particular question. Is it because of airway? Is it because of breathing? Is it because of circulation? Because remember, in this question, you have unstable patients. You have A, someone with severe pain in the abdomen. Letter B, someone with a left hip dislocation. C, that would be someone with a possible COVID infection. Or D, someone who needs pain medicine due to a severe migraine headache. Okay, so let's have the answer to this question, everyone. Okay, so let's see. So some of you are giving us answers like D. Some of you are giving us answers as C. So let's see. Can you give the rationale? Okay, so somebody said C because it's the COVID. So we will find out. But what about letter D? Why did some of you answer letter D for this question? So the answer for this question, everyone, very quickly is going to be letter, everyone. That would be letter C. Very good, everybody. C is the answer to this question. Using your ABC, okay, but I think Menchi mentioned something about safety as the reason for her answer. So can you elaborate, Menchi, why is safety the reason for letter C as the answer? Okay, is it because of airway problem? So remember that, what do you mean by safety? Okay, everyone. So most of you are saying safety, but why is C the answer? C is the answer because this is a patient who comes to the emergency room who reports fatigue and runny nose, and the situation already says it's possible COVID-19 infection. What is the first thing that we need to do right away when someone comes in and says, 10 of my family members have COVID at home, I'm coming over here, I think I'm also having COVID? The first thing that you have to do is to isolate the patient, right? So you want to isolate the patient, although it is not confirmed, that this patient is having COVID, you still have to make sure that you isolate the patient, place the patient on respiratory precautions. You have to separate the patient from other patients. You want to make sure you isolate the patient until we verify or confirm if the patient is really COVID positive. So that's very important, isolating the patient. And it applies to any infectious disease. It could be a patient showing meningitis symptoms, a patient who's showing symptoms of tuberculosis. The first thing you have to do in the emergency room is really to quarantine or to isolate the person and separate from the other patients, because you don't want other patients to be at risk for cross contamination or getting the disease itself as well. So that's why letter C is the answer. Okay. Always remember NCLEX. NCLEX also focuses on this aspect on how we are supposed to respond to infectious diseases, even though they are just only suspicions, right? Now, letter A is also serious. Remember that. A is serious because you know why? You have generalized severe pain in the abdomen, and we don't know what's going on with that patient. Is there any intestinal obstruction going on? Is there any appendicitis going on? So A is also unstable and a priority, but it doesn't come first. Letter B, the 55-year-old client who sustained a left hip dislocation. That's also a priority patient, definitely. However, it is not the priority, compared to letter C. And letter D, someone asking for pain medication. That's also a priority, but it's in this situation. However, letter C is the best answer. So thank you very much, everyone, for getting the right answer. Okay. So airborne isolation. Okay. So especially if it's a confirmed case, right? So you need to isolate the patient right away. Okay. Now let's proceed to the next question, everyone. But before that, I would just like to show to you the signs and symptoms of COVID. Okay. So COVID is characterized by, these are actually signs and symptoms from the CDC, and I will show it to you later on, everybody. So number 2 question first, everyone, and I will show you the signs and symptoms of COVID. Okay, so this is our next question, everyone. Okay, all right. Okay, so a 52-year-old client with COVID-19 infection and diabetes mellitus is admitted into the unit. During morning rounds, which of the following findings should the nurse report to the provider immediately? Select all that apply. A, loss of smell. B, fatigue. C, bluish lips. D, confusion. E, cough. And F, chest pain. Again, a 62-year-old client with COVID-19, okay, infection and diabetes mellitus is admitted into the unit. So this is not unusual, because always remember that it's highly possible that someone could be having COVID-19 and at the same time different conditions as well are present, like diabetes. You could also have heart failure, or you can also have renal failure. So that's very much possible. So during morning rounds, which of the following findings should the nurse report to the provider immediately? Select all that apply. So is it A, loss of smell, B, fatigue, C, bluish lips, D, confusion, E, cough, or F, chest pain? Remember, this is a select all that apply question, everyone. Okay? Select all that apply question. So there's more than one answer, everybody, to this question. All right, so which items are you going to report to the provider? Okay, which items or which findings are alarming and you need to report them? Okay, so we have a lot of people answering now. Okay, so let's proceed. So I'll give you a little bit more time, everybody. Okay, and really determine the answer to this question. Always remember, when you say report to the provider immediately, you're seeing something that is alarming, something that is not usual. You want to report something that indicates the presence of complications, right? So what do you think is the answer? Select all that apply. Okay, so we have everybody still giving answers. Okay, let's see. Or maybe some people are changing answers too. Okay, so really, so what symptoms are you going to report to the provider? Okay, So let's have the answer, everyone. Okay. Be very careful with this question. Okay. All right. So the answer to this question, everyone, is going to be letter. Okay. So the answer to this question, everybody, will be. But before anything else, okay, maybe I have to show to you the signs and symptoms of COVID so that you will know the answer. Okay. So these are the symptoms of COVID, everyone. So the symptoms of COVID are the following. They may have fever or chills, cough, usually starts with a dry cough. So those are parts of the symptom. Shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and then also you have diarrhea. So those are the symptoms of COVID. Now, the CDC, or the Centers for Disease Control and Prevention, says that you also have to look for emergency warning signs for COVID patients. If someone is showing any of these signs, seek emergency medical care immediately. So we have a patient actually who was admitted, and these are warning signs of complications. And complications of COVID includes your acute respiratory distress syndrome and other complications. So one, you have trouble breathing, or meaning the breathing of your patient is getting worse, persistent pain or pressure in the chest or chest pain, new confusion, inability to wake or stay awake, and the last one is going to be bluish lips or face. So all over the place, if you're going to type COVID, symptoms in the internet, you will find out that all of these are the information all over the place, and these are the symptoms provided to us by the Centers for Disease Control and Prevention, as well as the World Health Organization. Okay, so the answer to this question now, I think everybody knows the answer after knowing that the answer, okay, or the concept. I have been distracted by Amberly a little bit. She said, hopefully that I might have the chance to win 90 day, but it's so impossible. Well, we will find out, okay? Because we're doing a raffle with that, okay? So just really pray very hard that you will win, Amber, okay? But anyway, so let's proceed, everybody. So the answer to the question is going to be letter C, D, and F. So congratulations for those who got the right answer, guys. I don't think that I have to explain the rationale for this, because I guess that after showing to you the signs and symptoms, right? Okay, from the CDC, you don't call the provider and say, I'm calling because this patient is having loss of smell due to COVID. And like, well, yeah, the loss of smell is part of the symptoms of COVID. So we expect that. Fatigue, or even maybe fever. You know, fever is the number one sign of COVID. So you don't, necessarily those are not signs of complications. Those are parts of the symptom. Even coughing or dry cough, or even congestion or runny nose is part of COVID. However, when you have bluish lips or face, or if you have confusion or a decrease in the level of consciousness and chest pain, definitely these are indications that complications have happened, or the patient is totally an unstable patient. So just remember that, everybody. Okay. All right. So hopefully you will be able to apply the concept. Okay. So who got the right answer to that question, everyone? Okay. All right. So thank you for that, guys. Okay. So hopefully you learned something from that. Hopefully you are all ready for our delegation and prioritization question as well. And this will be questions related to COVID again. Okay. All right. So let's have the next question. Yes. So Amber, with Matus, anything is possible. Okay. So thank you. Okay. So let's proceed. Delegation question. Okay. So this is your delegation question, everyone, for tonight. This is a lot of select all that apply. Okay. So the registered nurse works with unlicensed assistive personnel in caring for a client placed on the ventilator due to complications from COVID-19 infection. Which of the following tasks can be delegated to the experienced UAP? Select all that apply. A. Ensure the correct ventilator setting. B. Report when the ventilator alarms. C. Check the placement of the endotracheal tube. D. Assess for respiratory failure. E. Adjust the amount of oxygen administration. Or F. You have obtained the pulse oximeter reading. Okay. Again, so you have 6 select all that apply questions here. Okay, the registered nurse works with the unlicensed assistive personnel in caring for a client placed on the ventilator due to complications from COVID-19 infection. Which of the following tasks can be delegated to the experienced UAP? Select all that apply. A. Ensure the correct ventilator setting. B. Report when the ventilator alarms. C. Check the placement of the endotracheal tube. Assess for respiratory failure. E. Adjust the amount of oxygen administration. Or F. Obtain the pulse oximeter reading. Okay. Actually, this concept recently came out in the NCLEX. This concept actually came out in the NCLEX. Not the exact question, however, the use of principles in the NCLEX. So always remember that for the UAP, when we have to give them responsibilities or when we have to delegate tasks, it has to be simple, it has to be within the scope of practice, and it has to be simple routine only. Okay, so scope of practice, simple, and at the same time, it is something that is not complex, of course, that's what I said. Okay, so the answer to this question, it seems like everybody. Okay, so Amber said, delegate only simple tasks, not complex tasks, and within the scope of the UAP. Okay, so Amber is really giving us all the rationale tonight. Okay, all right. So we have Jenny said that B and F because assessment is part of the RN scope of practice. Okay, very good. Okay, so let's see to have more answers. So some people are still answering. Okay, so without waiting for a long time, everybody, the answer to this question is going to be letter what? Letter B and F. Very good. So the answer is going to be B and F because ensuring the correct ventilator setting is the responsibility of the RN. Letter C, check the placement of the endotracheal tube. That is the responsibility of a licensed nurse or maybe the respiratory therapist, okay, or any licensed professional, medical professional. D, assess for respiratory failure. That would be D, assessment is for the RN. Letter E, adjust the amount of oxygen administration. That is for a licensed nurse. So the correct answer is going to be letter B and letter F because B, report when the ventilator alarms. So you have 2 pressure alarm settings. Remember that, right? So you have that. So what does a high pressure alarm means? What does it mean? The high pressure alarm. Okay, if someone can tell me in the comment section. What does a low pressure alarm mean? Okay, so this alarm settings in the ventilator actually means something, right? So when you say high pressure alarm, it actually means that there is an obstruction. When you say a low pressure alarm, there is a disconnection. Okay, so I tackled that in the online NCLEX Academy. Okay, so Alumari is saying that she's praying to win tonight. Okay, so yes, obstruction is if it's a high pressure alarm. Very good. Okay, so the answer is going to be B and it's going to be letter, what is that? Letter F. And when it comes to ventilator settings, actually, the respiratory therapist, okay, can determine the ventilator settings, okay? But then who gets the order? That would be the licensed nurse, okay? The registered nurse, definitely. So again, RNs do not delegate. Can everybody repeat that again? RNs do not delegate evaluation, assessment, and teaching. So you call that EAT, all right? Okay, so let's proceed to the next question, everyone. Okay, all right. Yes, Fred has said that low alarm is going to be disconnection and high pressure alarm will be obstructions, okay, or kinks, for example. Very good. Okay, so let's have our next delegation question, everyone. The registered nurse and the licensed practical nurse care for a client recovering from a COVID-19 infection. Which of the following tasks may be assigned to the LPN? Select all that apply. A. Administer albuterol nebulizer treatment. B. Develop the care plan for discharge process. C. Evaluate the response to the use of incentive spirometer. Okay. Letter D. Perform a comprehensive respiratory assessment. E. Auscultate for wheezing or crackles. And F. Discuss instructions for follow-up treatments after discharge. Okay, so what's the answer to this question, everyone? Okay, so the registered nurse and licensed practical nurse care for a client recovering from a COVID-19 infection. Which of the following tasks may be assigned to the LPN? So this is a patient who is recovering, right? So A, B, C, D, E, and F. Okay, all right. So most of you are giving the answers now. Remember that only RNs can evaluate, only RNs can assess, and also only RNs can teach, right? Okay. So the answer to this question is going to be, okay, I'm still waiting for some other people. Some other people are still giving their answers. Okay. All right. Okay. So, okay. So let's have the answer, everybody, to this question. Okay. All right. So going back to the concept, before I give out the answer, everyone, I've always told you this, that LPNs can also assess, but the assessment is only what you call specific or focused assessment. They can get the information. So, but who interprets the data? That would be the RN. So the LPNs can check the color of the stool, can check the color of urine. The LPN can also auscultate bowel sounds, listen to the heart rate. But if it's anything that's in-depth or comprehensive, okay, or admission assessment, that has to be the RN, okay? Or any new incident that requires assessment, first time assessment, a new pressure sore, for example, a new skin tear, that has to be the RN assessing, okay? The assessment that can be done by the LPN is only focused or specific assessments. So let's give you the answer to this question, everyone, because I think most of you, okay? All right, so the answer to this question, everybody, is going to be letter A and letter E. Very good, everyone. So administer albuterol nebulizer treatment that is within the scope of practice of the LPN, giving medications orally or by nebulizer or inhalation. Or probably can also say another situation, the NCLEX could be administering meter dose inhaler, for example. Okay, the LPNs can do that as well. Okay, and letter E is within the scope of practice of LPNs to auscultate for wheezing or crackles in this patient. Letter B, develop the care plan for discharge process. We all know that's for the RN, developing the care plan. The role of the LPN in terms of care plan is just to make suggestions and to implement part of the care plan. Okay, now letter C, evaluate the response. So anything to do with evaluation of response to interventions, that would be the RN. Okay, like evaluation of response to pain management, evaluation to the use of incentive spirometer, for example. Okay, now letter D, comprehensive respiratory assessment or in-depth respiratory assessment, that will be the responsibility of the RN. Letter F, discussing this discharge instructions, definitely teaching, that would be for the RN as well, everyone. So thank you very much. I think most of you got the correct answer in this question. I think you did very well, everybody, tonight. So I hope that you enjoyed our questions for the involving the COVID tonight. So you have to make a guess next week. Okay, what will be the focus topic probably next week, everyone? Okay, so again, so for tonight, just kind of like telling you our programs, simple, fast, and easy to increase your chances of passing the NCLEX, knowing your content. Through our online NCLEX Academy, we have a lot of students online right now. And we do offer self-study programs, monthly subscriptions, and we do have ongoing live webinar classes right now. So we do have live webinar classes every Saturday and also every Tuesday. Actually, the live webinar that we have for Saturday will start in October 10 to December 19, 2020. That's going to be from 8 to 4 p.m. So visit our website, matusnursingreview.com. Okay. Now, another one we do have, one of the things that our students really love is the NCLEX Success Workbook, everybody. And it's 94.50. We don't have any sale right now, so just watch out for announcements. And with the NCLEX Success Workbook, it has fill in the blanks. It makes your studying really very interactive because by using this workbook, it's much easier for you to absorb the information because you're writing at the same time. Okay, and we have a lot of students who can attest to the effectiveness of the workbook. Okay, and it's really very affordable as well. Okay. All right, so visit our website. It's there, matusnursingreview.com. And of course, lastly, before we announce the winner for tonight's 90 Day, okay, winner, I do have my book online in Amazon. If you want to master your content in 7 days, then you have my book, Simple, Fast, and Easy NCLEX Review. So it's available in Amazon, in Barnes & Noble as well. And also, if you want to order in the Philippines, you can email matusnursingreviewacademy@gmail.com. Okay, so a lot of students, if you want to review the content. So always remember also that I have told you many times that the ultimate secret for passing the NCLEX, number one, is to master your core content. And then you attack it with questions to improve your critical thinking skills. Okay, so thank you very much, everybody. Before we announce our winner, thank you very much. Okay, thank you, Atet. Thanks for another informative night. God bless you and your staff. Stay safe. Thank you very much. Okay, worth every penny, all right, of your money. Thank you very much, Menchi. She's one of our students right now for the Saturday class. And then Claire is one of our winners. And also, thank you very much, Claire, for the acknowledgement. Okay, so let's see who is going to win tonight's free NCLEX review, 90 days, everyone. Our winner is going to be, okay, everybody, please congratulate this person. That would be Erica Fernandez. So congratulations, Erica, for winning our free 90-day online access, okay, NCLEX review. So congratulations, everybody. Please congratulate Erica. And if there's anything that you learned tonight, so type that in the comment section, okay? So thank you very much. There is a course that in the workbook, okay? So if you have any questions, just send us an email, okay? We're kind of like busy tonight because we have a lot of students inquiring also, but just be patient. We're trying to accommodate all students as much as possible. Okay, so again, thank you very much, everyone, for being here and for really following this session that we have every Thursday. And I would appreciate if you share this with your friends so that your friends will also benefit from the prioritization delegation sessions. All of these videos that we have in the past are all in the online academy. So if you enroll in the online academy, you can watch all of the previous sessions that we have for delegation and prioritization. So that comes with enrollment, everyone. Okay, so I want you to master your prioritization and delegation. So so this is the session that you have to go to. Okay, so thank you very much, everybody. And again, have a great night from Matus Nursing Review, where we make everything simple, fast, and easy in order to pass your NCLEX. Thank you very much, everybody.